From Bonnie Krasnoff being impaled by a pole to Lexi Gray being crushed under plane wreckage, throughout the 21 seasons of Grey's Anatomy, there have been tons of absolutely devastating deaths. In this video, we're going to cover some of the most heartbreaking deaths from least sad to most sad, starting with the tragic death of Bonnie Krasnoff. Bonnie Krasnoff's death in Grey's Anatomy's second season is honestly one of the most gut-wrenching moments the show ever delivered. Her tragic fate during that devastating train crash episode really forced us to face some impossible medical decisions and the harsh reality that sometimes love just isn't enough to save someone. When that catastrophic train wreck brought chaos to Seattle Grace Hospital, the emergency room was completely flooded with hundreds of injured passengers. Among all those victims were Bonnie, this young woman in her 20s, and Tom, a man in his 50s, complete strangers who suddenly found themselves literally connected by a metal pole that had impaled them both during the crash. What made it even more heartbreaking was how Bonnie and Tom actually formed this unexpected bond despite their dire circumstances. They were cracking jokes about needing breath mints and genuinely finding comfort in each other's company. But as the doctors started examining them, the devastating truth came out. The pole had completely severed Bonnie's spinal cord, leaving her unable to feel or move her feet, while also sitting dangerously against her aorta. The medical team was stuck with this absolutely agonizing decision. To save one patient, they'd have to sacrifice the other, because removing that pole would cause both of them to bleed out. After looking at everything, the doctors realized Bonnie's injuries were way more extensive than Tom's, making her survival basically impossible no matter what they did. They had to tell both patients the brutal truth. Bonnie would need to be moved backward off the pole to give Tom his best shot at living. Even though Tom protested that he should be the one to go, Bonnie accepted her fate with this incredible grace, even quietly asking Tom if he believed in heaven. During the surgery, when they separated them, Bonnie's aorta was completely shredded. While everyone else moved to save Tom, only Meredith stayed with Bonnie, fighting desperately to keep her alive and screaming that they just couldn't abandon her. Bailey had to call her time of death at 3:49, and honestly, it still hits hard every time you watch it. And if you thought that was sad, it's only going to get more sad as we dive deeper into the video. The next incident in this video is Doc's death, also in Season 2. This beloved golden retriever wasn't just a pet. He was the heart of Meredith and Derek's complicated relationship, and his tragic end from bone cancer forced everyone to confront the cruel reality that love doesn't always conquer all. Doc's story began when Meredith and Izzy adopted him from the pound to cheer Izzy up after losing a patient. But this sweet, mischievous dog quickly became more trouble than anyone expected, terrorizing George and Izzy with his lack of house training and destructive habits. When George delivered an ultimatum, either the dog goes or I go, Meredith was forced to give Doc to Derek and Addison, creating this weird shared custody situation that perfectly mirrored the messy love triangle happening between the humans. What made Doc's illness so heartbreaking was how it developed right as things were getting even more complicated between Meredith, Derek, and the veterinarian Finn. Doc started getting sick, becoming listless and refusing to eat, which led to Finn running tests that revealed the devastating diagnosis: bone cancer. The timing was cruel. Just as Meredith was trying to move on with Finn and Derek was attempting to repair his marriage with Addison, their shared dog was dying, forcing them back together in the most painful way possible. The decision to put Doc down was absolutely gut-wrenching to watch. Finn explained that the cancer had spread to Doc's brain, causing seizures, and there was no hope for recovery. Derek initially wanted to just let the vet's office dispose of the body, but Meredith couldn't bear the thought of throwing Doc away like garbage. Instead, they chose to bury him at the clearing by Derek's trailer overlooking the water. As Finn gave Doc the injection, Meredith and Derek held him together, their fingers touching in this incredibly intimate moment of shared grief that said everything about their unresolved feelings. The immediate aftermath of Doc's death was devastating for everyone involved. Meredith showed up at the hospital prom visibly shaken, trying to be happy with Finn, but clearly struggling with the loss. Derek was equally affected, and their shared grief became this catalyst that ultimately led them to having during the prom, completely derailing both of their attempts to move on with other people. Doc's death had lasting consequences that rippled through multiple relationship and story arcs. It marked the beginning of the end for Meredith and Finn's relationship, as she realized she couldn't fully commit to him while still having such deep, unresolved feelings for Derek. The shared experience of losing Doc also highlighted how Derek and Meredith were still deeply connected despite all their attempts to stay apart, setting up the emotional foundation for their eventual reunion and showing that some bonds promise just can't be broken, even by death. By the way, if you're enjoying this video and want to see more content like this, make sure to subscribe before we move on to the text moment of this video. The passing of Denny Duquette during Grey's Anatomy's second season remains among the series' most heartbreaking and cruelly twisted moments. This cherished cardiac patient had finally undergone his desperately needed heart surgery and asked Izzy Stevens to marry him, but tragically succumbed to the cerebrovascular accident mere hours afterward on what was meant to be the most joyful evening of his existence. Denny had been battling congestive heart failure for years, becoming a long-term patient at Seattle Grace Hospital, where he met and fell in love with surgical intern Izzy Stevens. His condition had deteriorated so badly that he needed a LVAD to keep him alive while waiting for a donor heart. The situation became desperate when a heart became available, but was set to go to another patient who was just 17 seconds ahead of Denny on the transplant list. This impossibly small time difference would have meant certain death for Denny, who was running out of time. The tension reached its peak when Izzy made the shocking decision to cut Denny's LVAD wire, deliberately worsening his condition to move him up the transplant list. It was an incredibly risky move that could have killed him instantly, but Izzy was willing to do anything to save the man she loved. The plan worked. Denny's condition deteriorated enough to qualify him as a 1A candidate, putting him at the top of the list. After a successful transplant performed by Dr. Erica Hahn, Denny's new heart started beating, and for the first time in years, he had warm hands and a regular heartbeat. The cruel irony came during the hospital prom that night. While Denny was recovering and making plans for his future with Izzy, a blood clot formed on his suture line and traveled to his brain, causing a fatal stroke. He died alone in his hospital room at 7:42 p.m., just as Izzy was getting on the elevator to visit him in her prom dress. The timing was absolutely devastating. She arrived just moments too late to say goodbye. Following Denny's passing, the emotional toll was devastating to witness. Izzy discovered his lifeless form and lay beside him on the hospital bed, unable to accept his departure as she grappled with the shocking reality. Her fellow medical students attempted to provide solace, but she remained utterly inconsolable, having sacrificed so much in her efforts to rescue him. And even after securing the organ transplant he required, destiny still claimed his life. Eventually, Alex was forced to physically remove her from Denny's side, explaining that what lay before them was no longer truly the person they had known. Denny's passing created lasting repercussions for all those touched by the tragedy. Izzy received an inheritance of $8.7 million, which initially caused her great internal conflict before she decided to establish the Denny Duquette Memorial Clinic with the funds. The psychological wounds from his loss plagued her for many years, manifesting as visions of him during her own battle with cancer. His demise also highlighted the ethical dilemmas inherent in healthcare. Though Izzy's choices violated protocol, her motivation stemmed from genuine devotion, prompting deeper reflection on the sacrifices we make for those we hold dear. The next death in this video is the death of Susan Gray, turning what should have been a simple procedure into a devastating family tragedy. Susan, Thatcher Gray's second wife and Meredith's stepmother, died from complications following a routine outpatient procedure for persistent hiccups, leaving everyone questioning how something so minor could lead to such a catastrophic outcome. Susan had been dealing with persistent hiccups and acid reflux that were seriously affecting her quality of life, preventing her from sleeping and causing her significant discomfort. She came to Seattle Grace Hospital seeking help, where Bailey initially treated her with chlorpromazine, an antipsychotic that also helps with hiccups. When the hiccups returned, Bailey recommended endoscopic gastropilication, a minimally invasive outpatient procedure to address the underlying issue. Susan was optimistic about the treatment, and everyone expected her to go home the same day and recover quickly. The situation began deteriorating when Susan developed a fever after the procedure, which Bailey initially thought might be a reaction to the antibiotics. She was admitted for IV antibiotics and had a central line placed so she could continue treatment at home. However, what seemed like a manageable infection was actually the beginning of a much more serious complication. Susan's condition continued to worsen, and she began experiencing severe cramping pains that signaled something was terribly wrong. The crisis reached its peak when Susan developed sepsis and a toxic megacolon with perforation, an extremely rare but catastrophic complication that can progress with shocking speed. Richard Weber explained that this was an incredibly uncommon outcome, but Susan needed emergency surgery immediately to have any chance at survival. As they rushed her to the operating room, Susan grabbed Meredith's arm, and Meredith assured her she would be okay. Tragically, Susan coded on the way to surgery, and despite the medical team's best efforts, she died on the operating table. Upon hearing the news, in his grief and anger, Thatcher slapped Meredith across the face, blaming her for Susan's death and saying that Susan had trusted Meredith when she came to the hospital with something as simple as hiccups. Meredith was left reeling from both the loss and her father's violent reaction, rejecting rejecting Derek's attempts to comfort her and running away to process the trauma alone. Her loss destroyed any progress Meredith and Thatcher had made in rebuilding their relationship, as he couldn't separate his grief from blaming Meredith for not protecting Susan. The tragedy also served as a harsh reminder that even the most routine medical procedures carry risks, and that sometimes medicine fails despite everyone's best efforts, leaving families shattered by outcomes no one could have predicted or prevented. Alice Gray's death in Grey's Anatomy Season 3 stands as one of the most poignant and complex losses in the show's history, marking the end of a brilliant but deeply flawed surgeon whose legacy would haunt her daughter for years to come. This legendary doctor, who had won 2 Harper Avery Awards and revolutionized surgical techniques, died alone from Alzheimer complications, just as her daughter Meredith was fighting for her own life after drowning in Elliott Bay. Alice had been battling Alzheimer's disease for years, living at the Rose Ridge home for extended care, where her once sharp mind had deteriorated to the point where she often thought she was still completing her surgical residency. Her condition was heartbreaking to watch. This woman, who had been one of the most brilliant surgeons of her generation, was reduced to confusion and aggression, sometimes not even recognizing her own daughter. The cruel irony wasn't lost on anyone that someone who had dedicated her life to healing others was slowly losing herself to a disease that medicine couldn't cure. The tension around Alice's death was heightened by the timing. It occurred during the devastating ferryboat accident that left Meredith clinging to life in the hospital's trauma bay. As the medical team worked frantically to save Meredith, Alice was in another part of the hospital, becoming increasingly agitated and unstable. The parallel between mother and daughter both fighting for their lives created this incredibly emotional backdrop that made everything feel even more urgent and desperate. Alice's final moments were both tragic and strangely peaceful. After becoming agitated, she was given lorazepam to calm her down, but her condition continued to deteriorate. Derek, overwhelmed by his own grief and anger about Meredith's condition, had confronted Alice earlier, blaming her for breaking Meredith with years of emotional neglect and calling her ordinary. It was a brutal but honest assessment of their relationship. When Alice finally coded, Derek tried desperately to resuscitate her, but she was unable to be brought back. She died at 54 years old, alone, except for the medical staff trying to save her. While everyone was focused on whether Meredith would survive, Alice quietly passed away, creating this strange mix of hope and loss happening at the same time. During Meredith's near-death experience, she got to see her mother one last time in what felt like the afterlife. Alice finally told her daughter she was anything but ordinary, something Meredith had waited her whole life to hear. It was sad and healing all at once, letting them make peace with each other just as Alice was leaving the world for good. Losing Alice changed everything for Meredith in ways that lasted long after that day. Having such complicated feelings about her mom's death, missing someone who had inspired her but also hurt her so deeply, made Meredith really look at how she handled relationships and her medical career. Even after she was gone, Alice kept affecting the show through her old journals, the surgical techniques she developed, and all the ways she both pushed and damaged her daughter. It proved that some characters are so complex, they keep influencing everything, even after they die. If you thought that was sad, just wait until we get on to the next person in this video. Harold O'Malley's death in Grey's Anatomy Season 3 stands as one of the most heartbreaking and realistic portrayals of losing a parent to cancer in television history. This beloved truck driver and father of 3 died from multi-system organ failure after what was supposed to be a life-saving surgery, leaving his son George and the entire O'Malley family devastated by a loss that both felt inevitable and completely unfair. Harold had been battling esophageal cancer that had already spread to his stomach, creating a complex medical situation that required him to have a heart valve replacement surgery before they could even begin treating the cancer. The whole situation was incredibly stressful for George, who was torn between wanting the best surgeon possible and dealing with his suspicions about Burke's hand tremor. After initially switching to Dr. Hahn, the family ultimately went back to Burke, and the valve replacement went well, giving everyone hope that Harold was on the road to recovery. The tension really ramped up when Harold faced his cancer surgery, which was meant to be mostly exploratory. But Harold, being the fighter he was, made the doctors promise to remove all the tumor no matter what they found. He told them O'Malley's are fighters and that his family couldn't lose him, so he needed to do everything possible to beat this thing. When they opened him up, they discovered the cancer had spread extensively throughout his stomach, liver, and lymph nodes. But they honored his wishes and removed as much as they could. The real heartbreak came after the surgery, when Harold's condition rapidly deteriorated. His breathing tube kinked, requiring a dangerous replacement procedure that left the family terrified he might not survive. alive. Then his kidneys began failing, followed by his other organs shutting down one by one. The cruel irony was that Harold had been feeling better than ever after his heart surgery and had even gathered his extended family for what they thought would be a celebration before starting cancer treatment. The whole situation was just heartbreaking to witness. Harold's family had to face an impossible choice: whether to keep him on life support or let him pass away peacefully. George looked to Bailey and Richard for advice, but in the end, he had to make the call himself. He decided to take his father off life support because he could tell Harold was suffering. When they all gathered around the bed holding hands while Bailey shut off the machines, it was one of those moments that just broke your heart. Losing Harold changed everything for George in ways that went far beyond that terrible day at the hospital. He was really angry when he found out the doctors had done such aggressive surgery even though they knew the cancer had already spread everywhere. He felt like they should have known better instead of just doing what his dad wanted. Going through all that grief made George part of what Christina called the Dead Dads Club. Basically, people who knew exactly how awful it feels to lose a patient. The whole experience also brought him closer to Callie. It really showed how when someone dies, it doesn't just affect the patient. It changes entire families and communities in ways that no amount of medical training can really prepare you for. As we approach the halfway point of this video, I just want to remind you to subscribe, as it really helps out the channel. Charles Percy was a surgical resident at Seattle Grace Mercy West Hospital who became an innocent victim of one of television's most devastating hospital shooting episodes. His death in Grey's Anatomy Season 6 represents the tragic loss of a young doctor whose life was cut short by senseless violence. Following the merger between Seattle Grace and Mercy West Hospitals, Charles Percy transferred as a third-year surgical resident, trying to prove himself in a competitive environment. The hospital had become a pressure cooker of professional rivalries and personal tensions, but nothing could have prepared the staff for what was about to unfold. Gary Clark, a grieving widower whose wife had died at the hospital, entered Seattle Grace with a gun and a devastating plan for revenge. He was specifically targeting Dr. Derek Shepard, Dr. Richard Weber, and Lexi Gray, the medical team he blamed for his wife's death. The morning started like any other at Seattle Grace, with residents going about their duties unaware of the danger approaching. Charles was working with Dr. Miranda Bailey on Mary Portman's case, a patient scheduled for a colostomy reversal surgery who needed a blood transfusion first. The atmosphere was typical hospital chaos: busy, focused, routine. Charles, though sometimes seen as trying too hard to fit in, was genuinely dedicated to his patients and his craft. He had been working to establish himself among the competitive residents, often being called upon for heavy lifting due to his size, and had developed a quiet crush on his fellow resident Reed Adamson that he never confessed. The normalcy shattered when Gary Clark began his rampage through the hospital. After shooting and killing Reed Adamson and wounding Alex Karev, Clark methodically searched for his targets while the hospital went into lockdown. Charles was in Mary Portman's room with Dr. Bailey when the terrifying news reached them. There was a shooter in the hospital. As staff members screamed and ran through the hallways, Bailey spotted Clark approaching their room. In desperation, she ordered Charles to hide in the bathroom and told Mary to play dead under a sheet. Bailey herself crawled under the bed as Clark entered the room. The gunman briefly checked on Mary, thinking she was already deceased, but then heard a sound from the bathroom. When Clark opened the door and found Charles hiding, he asked a simple, chilling question: "Are you a surgeon?" When Charles honestly answered yes, Clark shot him in the abdomen without hesitation. The young resident collapsed in agony while Bailey watched helplessly from under the bed. After Clark left the room, Bailey and Mary frantically tried to save Charles's life with limited supplies. Bailey applied pressure to his gunshot wound, while Mary, despite her shock and terror, helped gather surgical pads and supplies. Charles was in excruciating pain, repeatedly saying he'd been shot, while Bailey worked desperately to stop the bleeding. The wound wasn't holding, and Bailey knew Charles needed to get to an operating room immediately. It was his only chance of survival. They managed to get him onto a sheet and drag him toward the elevator. But when they arrived, Bailey realized the elevators had been shut down as part of a lockdown protocol. Standing there with a dying resident and no way to get him the help he needed, Bailey completely broke down. Knowing this meant Charles would die. Charles Percy's death devastated everyone at Seattle Grace and meant so much more than losing a coworker. His final moments were absolutely heartbreaking. As he was dying in Bailey's arms, he asked her to find Reed and tell her he loved her, not knowing Reed was already gone. He also wanted Reed to know he died brave, and Bailey told him he was very brave. His last words to Bailey were, "You were always my favorite doctor. I thought you should know." Charles's death showed how the shooting didn't just end lives, it destroyed all the possibilities those people had. He was a young doctor just starting out with so much he could have given to his patients and medicine. The fact that he was killed just for being a surgeon made the whole thing feel so random and pointless. For Bailey, who was always tough on her residents, losing Charles details made her realize how responsible she felt for the young doctors she was training. His death, along with Reed's, completely changed how everyone who survived thought about their workplace and their own safety, leaving trauma that would stick with Seattle Grace for years. While that was sad, the death of Henry Burton was just as, if not more sad. Henry Burton was the patient who became Teddy Altman's husband in Grey's Anatomy, and his death remains one of the show's most devastating moments. What made it especially tragic was that Teddy had no idea her husband was dying while she was saving another patient just floors away. Henry started as just another uninsured patient with von Hippel-Lindau syndrome who desperately needed surgery but couldn't afford it. When Teddy proposed marriage so he could get on her insurance, it seemed like a practical arrangement that would save his life. Over time, their fake marriage blossomed into real love, with Henry even dreaming of going to medical school to follow in Teddy's footsteps. But his rare genetic condition meant tumors could appear anywhere in his body at any time, making every day uncertain. The morning of his death, Henry had been coughing up blood and came to the hospital for what seemed like routine treatment. That particular day was already chaotic at Seattle Grace, with multiple traumas coming in simultaneously. Henry's tumor was located dangerously close to his heart, requiring delicate surgery that could go either way. Meanwhile, another patient arrived with a life-threatening heart condition that desperately needed Teddy's experience. The hospital was stretched thin, and difficult decisions had to be made about who would operate on whom. The tension was building as both cases became increasingly urgent, and the medical staff found themselves juggling multiple crises at once. The cruel irony unfolded when Richard Weber and Owen Hunt made the devastating decision to have Christina Yang operate on Henry without telling her it was Teddy's husband. They draped his face and referred to him as only a 35-year-old male to keep Christina focused on the surgery rather than the emotional weight of operating on her mentor's spouse. During the operation, Christina encountered severe complications when the tumor had eroded through Henry's pulmonary artery, causing massive bleeding. Despite 20 minutes of desperate attempts to save him, Henry died on the operating table at 8:52 p.m., while Teddy remained completely unaware in another OR. The immediate aftermath was devastating for everyone involved. Christina was traumatized when she learned she had been operating on Henry, feeling betrayed by her colleagues who had put her in that impossible situation. Owen was forced to lie to Teddy for hours while she continued her own surgery, asking cheerfully about Henry's recovery between procedures. When Christina finally told Teddy the truth in the scrub room, the moment was absolutely heartbreaking, as Teddy simply asked her to say it clearly: Henry is dead. Henry's death changed Teddy forever, marking the end of her brief period of happiness and love. It showed how the demands of being a surgeon can rob you of the most precious moments with the people you care about most. The tragedy wasn't just that Henry died, but that Teddy spent his final hours saving someone else's life while completely unaware that her own world was ending. His death remains one of Grey's Anatomy's most emotionally devastating losses because it perfectly captured how cruel timing and duty can steal away everything that matters in an instant. Before we move on to the death of Lexi Grey, I want you all to comment what videos you would like to see in the future. Lexi Grey was Meredith's younger half-sister who became one of Grey's Anatomy's most beloved characters, only to have her life tragically cut short in the Season 8 finale plane crash. Her death remains one of the show's most devastating moments because of how much potential and love was lost in an instant. When Lexi first arrived at Seattle Grace as an intern, she was this bright, enthusiastic resident with a photographic memory who desperately wanted to connect with her half-sister Meredith. Despite Meredith's initial coldness, Lexi never gave up trying to build that relationship, and eventually they developed a genuine bond. Throughout her time at the hospital, Lexi had complicated relationships with both Mark Sloan and Jackson Avery, but it was always clear that Mark was her true love, even when their age difference and life circumstances kept pulling them apart. She was brilliant in surgery and had finally found her place in neurosurgery under Derek and was just starting to really come into her own as both a doctor and a person. The day of the plane crash seemed like it would be routine, just another trip to Boise for a surgery to separate conjoined twins. Lexi was traveling with Meredith, Christina, Arizona, Mark, and Derek, excited about the complex case ahead. But as they flew over the Pacific Northwest wilderness, something went catastrophically wrong with the plane. The tension built as the pilot struggled with mechanical failures, and you could see the fear in everyone's faces as they realized this wasn't going to be a smooth flight. When the plane crashed into the remote forest, the back section broke off, completely separating the passengers. Lexi found herself trapped under a massive piece of the aircraft that had crushed her pelvis and legs. She was conscious, but couldn't move, using a belt to bang against the metal to signal for help. When Mark and Christina finally found her, it was immediately clear that her injuries were catastrophic. Her pelvis was completely crushed, and she wasn't even sure if her left arm was still attached. Despite Mark and Christina's desperate attempts to lift the wreckage, it was impossible. Lexi knew she was dying. As Lexi lay dying, she asked Mark to tell Meredith she'd been a good sister and to say something to their father. Mark couldn't accept what was happening, so Lexi took his hand and they started imagining their future together, their wedding, the children they'd have, how perfect they were for each other. Mark finally told her he loved her, and her final words were meant to be. Before she died, he gently closed her eyes while still holding her hand, and when Meredith and Christina found them, they all grieved together in that terrible place. Grey's Anatomy was never the same after losing Lexi. Her death marked the end of the show's hopeful early days and brought in a much darker tone. Meredith was crushed. She'd only just learned what it meant to have a sister. Mark was completely broken and never really got over losing the woman he finally realized was his soulmate. The hospital got renamed Grace Sloan Memorial Hospital for both Lexi and Mark, but that didn't make up for losing two people who had so much ahead of them. What made Lexi's death so brutal was how it showed that in Shonda's world, being young and talented and in love doesn't protect you from anything. Sometimes life just takes away everything good without any warning at all. Now, moving on to the final person in this video, we have Diane Pierce. Diane Pierce was Maggie's beloved mother whose death from inflammatory breast cancer became one of Grey's Anatomy's most emotionally devastating storylines. What made her death so tragic wasn't just the disease itself, but how Maggie's desperate need to save her mother ultimately led to more suffering than healing. Diane had lived a hard life, born in a two-room shed with 6 brothers and little love or food to go around. When she adopted Maggie as a baby, she described it as the universe giving her a gift, this brilliant, happy child who became the light of her world. For years, Diane had been the perfect mother to Maggie, never complaining, always supportive, even when her marriage fell apart and she eventually moved to Hawaii to make soap. She was that rare parent who genuinely seemed to have no regrets about sacrificing everything for her child's happiness. When Diane noticed a suspicious rash, she knew enough to seek out the best care possible, which led her to Jackson Avery in Seattle. The tension built when Diane received her inflammatory breast cancer diagnosis, but chose to hide it from Maggie initially. She started living life to the fullest, but eventually, the cancer spread, and Diane found herself caught between her own suffering and Maggie's desperate determination to find a cure. When conventional treatments weren't enough, Maggie pushed for an aggressive clinical trial that required lowering Diane's liver enzymes through a risky procedure. The other doctors were skeptical, but Maggie's medical expertise and emotional desperation created a powerful combination that was hard to resist. The clinical trial became a nightmare of side effects, infections, fluid buildup, skin irritation, and constant weakness that left Diane barely recognizable. During what would be her final dinner with Maggie's friends, Diane tried to pass on her life wisdom and teach Maggie to make her famous lasagna, but the evening ended when she started coughing up blood. The trial had caused her esophagus to tear, requiring emergency surgery that Richard had to perform. As Diane lay recovering, Richard gently suggested she could stop the treatment if she wanted to, but Diane felt trapped by her love for Maggie. She couldn't bear to give her daughter the darkness of knowing she hadn't done everything possible to fight. The end was heartbreaking when Diane finally told Maggie she was ready to stop fighting. In their last conversation, Diane shared some final advice. Find someone who loves you a little more than you love them. Never make yourself smaller for anyone, and remember to have fun. While Maggie was painting her mom's nails and they were talking, Diane quietly died as Maggie went to open a window, noticing the rain had stopped. Maggie kept painting her mother's nails, even as she cried. It was such a sad moment, showing how hard it was for her to let go. Losing her mom completely changed Maggie, since she'd never really dealt with grief before. Finding out that Diane had known she was dying way before getting treatment made it even worse. She'd come to Seattle because she knew Jackson would look after Maggie when she was gone. The whole thing showed how love can sometimes make us fight for things that aren't really helping, and how hospitals can give false hope when families are desperate. Diane's story was one of the most realistic cancer storylines on Grey's Anatomy. It showed that sometimes the hardest part isn't dying, it's knowing when to stop trying to fix everything. If you enjoyed this video, make sure to subscribe, and I'll see you in the next video about the saddest death in every Grey's Anatomy season.